therapist or seeking counseling because they were thought that you had demons in you. Remember, my seniors? You had demons in you. So here go, we take you to the voodoo doctor. And the voodoo doctor is supposed to bring it out of you. No, it doesn't work that way. You still stuck. You still stuck. You still not fixed. And that's where we come in at. Now, going back to development. They didn't get a chance to, especially my mother and my grandmother. I think my grandmother went to the first grade. My mother was able to get her education. They wasn't able to develop mentally, properly. And when you do not develop properly, mentally, your cognition is not, what's the word I'm looking for, Dr. Taylor?
What is it?
Cognition. Your cognition is...
Cognitive distortion?
Yes.
Yeah.
So when you have cognition distortion, you can't think straight. You cannot think. You cannot make sound decisions. You cannot process life right. You're unhappy, and you're sad, and you're depressed. Dr. Taylor?
Yeah, cognitive distortion is kind of a clinical term that we use in psychology. What is it? It's the way you see things. It's how you give meaning to things. Like, usually people that experience anxiety usually exhibit cognitive distortion. You know, you may be saying, for example, I'll give you an example. You walk in here, you can be distorted. You may say, well, people don't like me because they don't speak to me. That's a distorted way of thinking. And we come in as psychologists to say, well, where is the evidence? When your mind reads somebody, it means that you're not accurate because you cannot go in somebody's mind to see what's in there. So we help the patient or the client to see things accurately. We say, well, let's come up with a different way of seeing things. So that's what cognitive distortion is, a distorted reality of things. But I don't know, Dr. Davis may want to talk more about bipolar dimensions and what is bipolar. A lot of people are quick to label someone bipolar, but people should be very careful when they say I am bipolar, because you have to meet the criteria of bipolar. If you don't meet certain criteria, you cannot be diagnosed as bipolar. But let's go back to the main topic, trauma. Now, most of us that experience trauma growing up as children, I experienced physical trauma. I was physically abused as a child, and that can affect our psychosocial development. Racism, discrimination, all those things are trauma. You know, so how do you cope with those trauma? Those are things that we work with our clients to develop effective coping skills to deal with those issues. And we see a lot going on. Dr. Davis, you want to jump in?
So examples of trauma, as he just stated, physical abuse, sexual abuse, bullying, family intimate partner violence, domestic violence, community violence, traumatic grief, medical trauma, terrorism, natural disasters, serious accidental injury, neglect, emotional abuse, impaired caregiver, forced separation, war, trafficking, sin or suicide, racism, or discrimination. What are signs of trauma? Post-traumatic stress disorder, changes in physical, and emotional reaction, being easily startled or frightened, always being on guard for danger, self-destruct behavior such as drinking too much or driving too fast, trouble sleeping, trouble concentrating, irritable, angry outbursts or aggressive behavior, overwhelming guilt or shame. Some of you all, I'm talking to some of you all now. I'm sure you all have experienced this one way or another. Now, how does your body respond to trauma? Initial reaction to trauma can include exhaustion, confusion, sadness, anxiety, agitation, numbness, dissociation, confusion, physical arousal, and blunt affect. The best way of how to deal with trauma, especially family trauma, is to get some help. Not only do you just pray, because you're supposed to pray to God. You're supposed to have a personal relationship with God. That's your personal relationship with God. But get some help. Use common sense. We from Chicago. We have to use street sense too. And you have to use book sense. Get some help. Seek out therapy. Dr. Taylor and I have brought our cars. Get some help. We have quite a few black therapists at the Psychology Center. You do not have to come all the way to the west, the south side. We're south side. You don't have to come all the way to the south side. We do therapy services on Zoom as well as over the telephone for those who do not know how to use Zoom. It is very important to make sure that your psychological mental health is sane. You may not think that nothing is wrong with you, but if you hot one minute and cold the next, something's wrong. If I turn around and look at you and you mad, and then I look at you 5 minutes later and you smiling, you need to get some help. Because something is going on. You have personality disorders. You have mood disorders. Find out what's going on with you. Some people have obsessive compulsive disorder where they have to wash their hands a lot. Some people have PTSD, are veterans. Get some help. Like seriously. There's too many people walking around here that's mentally insane. I have never in my life on this earth seen so many people walking the street talking to themselves. Too many of them. All the crime that's going on, it's not just gangbangers. Those are people that's mentally disturbed. And we need some help. We need more people out here getting more help than ever before. Don't sit on it. Don't ignore it. Do not ignore it, please. Even if a family member, you just pull them to the side and just call them. There's quite a few of us black therapists out there, you'd be surprised. I see a lot of people that so does Dr. Taylor on phone, on Zoom, and in person. And we still not burnt out. We're not tired. Why? Because we love what we do. My final saying is I really want you guys to try your best to seek some help, even if it's just for one session. And you feel like you need more, then do it. So that way you can get yourself together mentally. Because it's not easy out here, and it's not getting any better. And it's not going to get any better. We have Trump trying to get back in office. We have Proud Brothers we have to deal with. You think it's easy being black? I think everybody in here should know that question. Or that answer, brother. It's not easy being black. You think it's easy? Just because we have PhD, you think we still don't get discriminated against? sometimes from our own kind. So, I want you all, and I want to thank everyone. I want to thank Pastor Cat and Anderson for having us. Thank you so much. I want to thank Mr. Taylor as well for coming along to help with bringing knowledge to you all, to encourage you all that you are not alone, and do not be afraid to get therapy. So many people think it's embarrassing. No, it's not. It's embarrassing that you're not getting help. And that you're walking around here sad, depressed, dealing with trauma, dealing with headaches. You're wondering why you have a headache all the time because you're sad. You don't have no reason to live. You don't find no reason to live. Because you're here. I tell some of my wannabe suicide victims, you gonna kill yourself for a temporary problem? All problems will end eventually. You just have to learn how to deal with the problem because more problems are coming. Get some help. That's my final saying. I will leave my cards here along with Dr. Taylor. Will have his cards here as well with a few other black therapists because I feel black people need to see black therapists. Because our culture understands our culture. Okay? I'm sure Dr. Taylor has his final.
Hi, before I go, I want to advise everyone here I'm going to repeat myself, not to self-diagnose yourself. Because you don't want to label yourself with something you don't have. A lot of clients come into my session, they say they're depressed when they're not. They only have adjustment disorder. A lot of people come into my session, they say they're bipolar when they don't even meet the criteria for bipolar. So do not self-diagnose yourself, reach out. Now, stigmatization, I understand, there's nothing to be ashamed of. Each and every one of us here do have some form of personality disorder, or that we need help. It could be anxiety. So do not think that it is stigmatized, it will stigmatize you, no. Okay? I am really, really humbled to be here today to talk about mental health. And also I want to thank Pastor Anderson for giving me the opportunity to be here. Thank you so much.
I will not let them go without opening up for questions. Without opening up for questions. Because some of us are going to get this information and we still not going to do nothing with it. Hold on a second. When we are in a setting like this, the worst thing about us is we are in agreement for the moment. But when the moment is over, we go back to our own way of doing things. Generational curses are real. Family hurt is real. Family trauma is real. And some of you all, and I've been honest, you know you've experienced what these two individuals have addressed on today. And so there one person stood for a question. And then, okay, there's two. See, I knew we had some questions. We're going to do this the right way. Because God wants us to be in good health and prosper. I'm telling y'all, I'm going to hug over these sisters. Because I want God to rub off some of that favor that's on their life. On mine. Y'all think I'm joking. I don't know if she's still doing it, but up until this pandemic, Mother Price was going to gold weekly. I've seen Mother Loretta they had to snatch the mic from her and escort her to her seat. And she did just start doing this. Go on YouTube. They got a recording, If I Perish. They almost had to escort her out the scene. This is the grace of God that we want. But can I tell you, I want the mental stability as well. I laugh all the time, and y'all hear me talk about Mother Joe. Mother Joe don't be asleep for nothing. You can be talking to Mother Joe, and in a split second, Mother Joe is sleeping. She didn't lose no sleep over nothing. That's the mental stability that I need in my life. Prophet Shonda, you gonna come on with your question? Then the young lady in the back, I don't know your name, and then I see
Brother Evans.
And then we go Brother Evans.
Evans, yes indeed.
Sister Evans' son.
Yes, sir.
Oh, well, praise God. Good to see you, sir.
Thank you so much. I don't know if it's necessarily
It's
a
a
question
voice
or
right
a
there.
comment.
Pass that around.
You want me to pass this around or don't pass it?
And Deacon, you
Yes,
can
sir.
go to us.
Yes, sir, indeed. More of a statement than a question, Pastor. Is that okay? For a moment. Majority that are represented here today, that are here at church, here online, and here in this community, we want you to know that they have partnered with Pastor to actually come forth to give us the healing word so we can heal this community. You heard her say, I came from the south side to the west side because it's time. You heard Pastor say, you have to start being honest with yourself so you can get healing. 8 years ago, I was diagnosed with PTSD, severe depression, severe anxiety. 8 years ago, I was suicidal. 8 years ago, I didn't know my head from my tail. And 8 years ago, I didn't know if I was coming or if I was going. But God. Yeah, God stepped in, but then I had to do my faith without works instead. Dr. Taylor and Dr. Davis actually housed my family and I for us to continue with our own therapy journey. And what I can tell you today, I'm not playing games when I tell you that I have tasted and seen that the Lord is good. When I tell you that I know that Jesus came that we might have life and that we might have it to abundance, I'm not saying it to tickle your fancy. I'm saying it because I had to heal. I had to deal with those things that I was told as a little girl I could never say. I had to deal with the bullying. I had to deal with being called white Shonda because I lived in the hood and the way I enunciated my words didn't match. I had to deal with a lot of things and I had to process and understand what that is. You all have been told things about yourselves that have not been truth. And it has now permeated and became truth to you, and it's not true. That's what Dr. Taylor was expressing to us when he was talking about us having false belief systems. And what we do is we cover it up with the word, and that's all cute and all. But again, like Dr. Davis said, when you go home and you have to deal with yourself, you can't even move. Your house a mess. Yeah, because mine was. I couldn't cook. I could work. I was killing it on the job. You couldn't beat me any day. Any day I was killing it on the job. But when I got home, suffering. My children suffered because I suffered. That is not what Jesus died for you. That is not the life that he has for you. And so before we can go forward to tell the police what we demand, what we deserve, we have to know it. We have to understand it. We have to heal it. It's imperative that you begin your journey.
The young lady back there in the back, and then Brother Evans.
Thank you. My question is about your statement about self-diagnosing. You know, when you go to the doctor and you tell them your symptoms, and they diagnose you with one thing, and then it doesn't quite feel right, the treatment, and then you go to another doctor, and then they make a different diagnosis, and that seems to fit. So my wondering is, how does that work with mental health? Let's say you go to a doctor, they diagnose you as having depression. You go through the treatment, but you don't see a change. Like, when do you advocate for yourself? What does that look like without it being self-diagnosing?
Both of us will answer that question. We do a battery of tests, assessment over time. We do a battery assessment. We do a clinical interview. I'll let him finish.
What's your name over there?
I want to respond to the question that she was asking. LaShonda said she was diagnosed with PTSD, right? Now, here's the thing. PTSD and acute stress disorder are similar. The difference is the duration of time. How long? Now, you're going to be diagnosed with PTSD, anything, if the duration is over a month. But anything that's shorter than a month, it's acute stress disorder. So now, only a clinician, the therapist will be able to know the difference though. Now, if you go see someone who doesn't diagnose you properly, and the person tells you that you had PTSD when it is acute stress disorder, then you've been misdiagnosed. But one of the things that we look for in psychotherapy is progress. Okay, you come into a session, maybe you want to do 90 session. You know, I'm going to reevaluate you in 6 weeks to make sure you're making progress. Now, if you're not making any progress, I'm going to change my approach. It is not the goal. The goal, you're there for, once you've been diagnosed, you're there for whether it's anxiety or depression, but it could be the approach that I'm using. Cognitive behavior therapy is a big umbrella. So maybe the approach that I'm using needs to be changed, but the goal stays the same. You see, so that's why it's up to you to determine whether you're making progress. Okay? Yeah, Dr. Davis.
So, to answer your question really clear, so everyone will understand, we use a battery of assessments. Okay? And then we do a clinical interview. And then a lot of times I send people out to get a CDC panel, a blood panel. Why? Because if you have thyroid, your thyroid is messing up, you can have high anxiety and don't even know it. So it's always good to keep up with your PCP to make sure that when you get your blood work done, I want to see those numbers. I have quite a few clients like that, by the way, that their thyroidism, they have hypothyroidism, and that causes anxiety. So it's not, it can be biological. So I send people out to get CAT scans, PET scans, MRIs, just to make sure, because it could be some